Well, good afternoon, everyone. Thank you for joining us today. Welcome to our webinar on COVID-19 workplace safety. My name is Angela Huesman. I'm with Lakeshore Advantage, and I'm moderating our webinar today. I am pleased to welcome our speakers, Sean Egan and Brian McKeever. Sean is the Director of COVID-19 Workplace Safety and the Deputy Director for Labor in Michigan's Department of Labor and Economic Opportunity, so that's known as LEO. But he also oversees MIOSHA. Brian is co-founder and solutions architect at BizStream. That's a software solutions company located in Allendale, and he's the mastermind behind the SimReport, which is a mobile-friendly symptom tracking app that he's going to demo for us today. So before I turn it over to our speakers and let them control the screen, just a couple housekeeping items. We are recording this session, and it will be available on our website after the presentation. It also gets sent out to all registrants after the webinar. And additionally, we asked for questions upon registration, and we'll have time for that Q&A at the end. So the chat function is off for the webinar today. However, at the end, we'll have some contact information of where you can send questions should you have further or very specific questions that need follow-up. And in case we run out of time and don't get to them all, just know that you'll be able to follow up on those if you have additional questions. Okay, Sean was recently appointed the Director of COVID-19 Workplace Safety. It's a new role at the state, and in addition to this, oversees MIOSHA as Deputy Director of Labor at LEO. Sean, you have a lot on your plate right now, so I really appreciate you taking the time to be with us today. I know our attendees are interested to hear directly from MIOSHA, so I'm going to turn it over to you, and we'll let you go ahead and take control and show us what you've got for us today.
Absolutely. I really appreciate the opportunity. My name is Sean Egan. I guess I don't need to repeat that. So I just want to touch base with you. I want to share with you that first and foremost, I am a West Michigander. I live on the east side of Grand Rapids over by Lowell, Saranac area. I've been over here all my life, and I would like to mention, if you haven't been paying attention, that our numbers are not very good over here, and I think we can do better. And I think a lot of people are trying, and I appreciate that, and I see it every single day. And these outreach events are critical for us to be able to do what we need to do. So what I always like to do is just remind everybody that, there's a lot of noise around COVID. We have a 24/7 news cycle and a never-ending stream of information heading our way, but some of the science is staying pretty static. And that's that this is largely transmitted by large air respiratory droplets. Those things we're used to, and that we can really mitigate this hazard through the wearing of those face coverings. And some of the science is telling us about 70% or so mitigation by using these face coverings. Also washing our hands and maintaining that social distance to ensure that we're not transmitting COVID. One of the things I'd like everybody to start thinking about, and we've posted some information on that I won't touch on the page that you're looking at, is as we all know in Michigan, it doesn't stay warm forever. So some of the mitigation tools we're using to stay outdoors are going to become less likely as we move forward. So be thinking about what you're going to do with your indoor air quality. You've seen some of the information on opening windows and other things. We've posted on our Michigan Department of Labor webpage. There's some other resources there that you can use. And I've posted there the ASHRAE information. Now, if you're not familiar with ASHRAE, you're obviously not an engineer. For every engineer, they know what that is, but that's sort of the gold standard for HVAC system. And they've posted some COVID response plans that you can use for a lot of different types of industries. And some of them are quite simple, including just upgrading to a air filter with a MERV rating of 13 or above. So, take a minute to check those out when you have some time. But today I want to talk to you about what MIOSHA is doing and what we're doing at the Department of Labor. So since the beginning of this crisis, we have been developing a suite of tools, resources, and information for employees and employers out there so they can try to do their best. We know that there is a lot of information on things that you should be doing, on things that you can be doing, and navigating that can be a challenge. So we have a dedicated website. It's michigan.gov COVID Workplace Safety, the one that you're looking at now, that houses all of the information put together by our communications team and MIOSHA. So we know that many of you worked on the work groups the governor convened, and created best practices. We have those on the LEO website. This website is specifically dedicated to information created by MIOSHA to better outline what you absolutely need to be doing. And some of those other pieces we view as sort of reach goals or best practice goals beyond what's required here. And some of those best practices include a lot of the pieces in the MIOSHA docs, and they have additional features. So you'll definitely want to check these out. Now, I get asked all the time about enforcement, what's enforceable, and I will spend very little time on that because our goal at MIOSHA and within the Department of Labor is to educate and consult with folks so that they understand what they need to be doing, especially in something like this where we're all preparing and fighting through it together and at the same time. So we do have enforcement levers if we need them. You have been utilizing the general duty clause. We were among the first in the nation in our state plan, OSHA plan, to do so, to enforce these requirements, to enforce the executive orders, the CDC requirements for the workplace, and the other things that you've seen. So if necessary, we do have that enforcement tool, but largely we're trying to do this through outreach and education. So on this website, we've posted guidelines created by MIOSHA for every industry that's been named in one of the executive orders. If yours has not been named, we do have general industry guidelines. Now, for most of you that have dealt with MIOSHA, you understand that there's general industry guidelines, which everybody has to do, and then there are specifics for certain types of workplaces. The guidelines named specifically for a workplace include those general industry guidelines as well as the additional requirements for your type of workplace. And if yours isn't specifically listed, find one that's close to you and check that one out. By and large, though, you'll be able to find what you need there. Obviously, there's a lot of information there, so I'm not going to go through each of the guidelines. They are available to you at any time. And we've also created a sample preparedness and response plan created by MIOSHA. In the executive order, every business is required to have a preparedness and response plan. And this is it. Low and medium risk employers are those that are typically not in the medical industry. So there's a ranking system that you need to do as an employer with your employees on their risk characteristics. And you can find that in all of these guidelines as well, and it was developed by federal OSHA. So high and very high risk categories are those folks that are going to be dealing with known or suspected cases of COVID, so sick people by and large. Certain dental procedures kind of move them into a high risk category, so they'll want to check that out too, because some of the work they're doing is creating aerosols. But by and large, the vast majority of Michigan employers, manufacturers, retail, restaurants are going to fall into what we would consider these low and medium risk employee groups. Now, medium risk is probably going to be a large segment of that. And these are folks that have high interaction with the general public or coworkers in the workplace, which is why you're seeing so much information about face coverings and where you need to wear them. The face covering requirements, which we'll cover, I think, in some of the questions too, the Executive Order 153 now, it was 147, that requires us all to wear a face covering when we're outdoors and cannot maintain social distance, or we're indoors in a public space, is for us as individuals and some requirement for those businesses to enforce it. What we're going to want to look at is Executive Order 145, which creates the workplace requirements for us. And those have been modified to a degree. So an office setting per se, if you are lucky enough to have a private office and you're in there by yourself, you're not going to have face covering on. But if you're leaving your office and going into those common areas and hallways and elevators and bathrooms, you're going to need to wear that face covering. And the goal there is that the science is telling us that if we're both wearing those, we cut the transmission risk by about 70%. So think of that as a workplace safety tool. If you're wearing one and I'm not, that transmission risk is still really high. If we're both wearing them, we're cutting the potential transmission by about 70%. So that's why we need to be wearing those. We have checklists here. We have fact sheets here. We have all the posters, well, not all of them. We have many, many posters that you can use for your workplace. And we have them in multiple languages. And it's one of the tools that we really like to highlight is we know there's some posting requirements in there. And we do have, for many different types of industries, most of the posters that you're going to need. including gyms and restaurants, wearing a mask when you come in, some other handouts. And again, we have them in a lot of different languages, because if you didn't notice, in Executive Order 145, which reissued those workplace requirements, it includes you to provide this information and posters and things in languages common to your workforce. And we phrased it that way because we know that a lot of workforces are different on the makeup of the folks that work there. Certainly, everything's pretty much available in Spanish. And then we do have some social media tools that you can use if you'd like. We have other links here that are very valuable to you. So the MEDC, Michigan Economic Development Corp, has created a platform where you can go and find Michigan manufacturers to get PPE. You can access that through here. This is some information on what suitable work means with unemployment. And finally, one of the coolest things that we did is that we won't get to all your questions today, but we've set up a hotline directly into MyOSHA, staffed by MyOSHA, that goes to MyOSHA folks. And it's 855-SAFE-C19. You can call in there with any kind of COVID-related question you have about your workplace, whether you're an employee or an employer, and they will help you get through that. Our average wait time is about 15 seconds. The average call is about 5 minutes, and it's working quite well, and we're pretty excited about it, and it seems to be working. And don't forget, as an employer, that we have a great consultation team over at MyOSHA that you can reach out to, and they will engage with you without threat of penalty or citations to work with you on making sure that your workplace is as safe as it should or could be. And make sure you're using those tools. But we are trying to make sure that we have everything you need here. We have some videos, we have some training tools, we have all the guidelines you ever wanted, and we're going to be updating this constantly. So make sure you come back here and check that out. And I'm going to stop sharing my screen now and turn it back over to I got to find the buttons.
Well, while you're finding the buttons, I'll take it from here. Sean, thank you so
thanks, Angela.
much. That was so informative. And I have to say, I am really impressed with the 15-second wait time on a hotline. That is traditionally not the case that you see. And so, I know that others are going to be thankful for that too, because when you want to call and talk to someone, it's great to be able to get right through.
Yeah.
So this is helpful. Great. Thank you. Next, Brian McKeever from BizStream. So Brian and the team at BizStream have developed a symptom tracking app called SimReport. And this affordable tracking solution is designed for employers versus the individual. And it's really to support that symptom documentation process. So Brian, I can't wait to learn more about this. So I'm just going to turn this over to you and let you share all about this site and this tool.
Great. Thank you very much, Angela. I'll share my screen here really quickly, and I'm assuming you can all see it. Again, as Angela mentioned, my name is Brian McKeever. I am co-owner and solutions architect at BizStream. We're a custom software development shop in lovely Allendale, Michigan. I've actually been in business for 18 years, all of them pretty much in either Grand Rapids or here in Allendale. And we serve customers in Michigan and as far away across all of North America into Canada and even South America with custom software solutions, websites, apps, and different things. So the history of this tool, I'm going to do really, really quick, and then I'm going to dive right into showing it. Basically, as Angela mentioned, with a partnership with Spectrum Health and Lakeshore Advantage, we've created an employer-facing tool and focused tool for employers to do symptom checking and reporting of that data for their employees. We call it SimReport. All those details can be found here on our website at simreport.com, which is what I'm just quick starting with. And it's also got some FAQs and easy videos for many of the things I'm going to show today in case you want to check it out later. But if you want to try this, it's available right now. And all you have to do is click that big Try SimReport button to create a workspace, as we call it. And a workspace represents your business or a location of your business. And I've already created one named Lakeshore just because, we're doing the Lakeshore webinar here. And I'm going to show you from first the employee point of view. It should be no surprise. This is something that is similar to all the tools that you may have already been using or have seen people like Spectrum Health use or other companies. The one difference here is our tool, you actually have a login because we track who you are and where you work if your employer has signed up for it. So when I sign in here, there's basically one option, and that is to take the symptom checker. And this is the familiar 3 questions you've seen many of these apps do. In fact, our questionnaire can actually be customized per employer, which is something that a lot of employers have asked us for. But basically, if I do my normal, I'm not showing any symptoms, answer the questions the right way, and I'm going to get my green check mark. That's the thing you probably have seen or are using, and you would walk into your building and show that to your workplace supervisor. That's not probably earth shattering, right? Not even all that exciting. The difference with our tool is that I'm now going to switch over and log in as an employer. So I'm going to log in, pretend I'm actually an employer, and actually don't really have to pretend because I have my 30-person business here in Allendale that we use this tool on every day at BizStream. When I log in as that employer persona, I have a couple extra options. I can do my own check, which would be the same 3 symptom check questions or a detailed questionnaire if I so choose. But one thing that we're trying to do for employers is focus on the ability to quickly manage a roster of employees and then see how they're doing, be alerted if there are symptomatic checks that don't go the right way, and be able to react quicker and kind of, at the end of the day, reduce the liability that you as an employer have, because now you have this data. And each day, who took the check, who didn't take the check, who came into the building, all those kinds of options. So really, we do that really simply with a roster. Our system allows you to either use an email address or just a unique identifier for an employee, just a random name that, in case we know that a lot of employers don't have every employee with an email address, you can upload a file that contains just employee number 123455, 123456, 123457. That doesn't matter to us. We do that through a quick CSV import. We have a lot of detailed instructions on how to make it really easy. But the idea is that once you get a CSV file out of your HR system or your employee management system, you simply click upload. I'm going to do this one example as if I had email addresses for all my employees. Our system says, hey, did you know that this contains an email? I'm going to say yes. And it says, yes, everything looks good in that file. And I'm going to then review, and I can see that I'm going to upload 9 employees. Click continue here and upload the file. So this just simulates taking all of my employees at my company and uploading them into the system. Try to make it really easy, and it should be fairly quickly to do that. Once they're in there, you have the ability to basically distribute this URL that represents your company through this announce box right here. You can put that in your own, company emails to the different employees, shoot that out, or you can actually invite them through the system. But I'm going to skip that today based off time. There is a way to do that though. Once you have your roster imported, you can see all the people in the list. You can see, all the information you've given us about that person, and it can be identifiable. It doesn't have to be, but basically I can then just send out an invite. And what that did is that just emailed every single person in the list that had an email address with that URL to log in and create their first password and get going. Once they're there, you can actually see through the reports system that earlier today, this employee passed. No one else has taken it yet today. That's all just kind of possible through the system, and you can go back in history to different days. And this is the thing that's different is other apps out there have the ability to do this, but they don't store the history and they don't give you that kind of peace of mind that I know what's happened with my employees. So, at a very minimum level, that is kind of what the system does. It's all about reducing the liability, knowing what's going on with your employees. And there's a lot more features that are in here, but things like customizing the questions per organization, having multiple locations per employee and employer, having the ability to share data with the state of Michigan is our last big feature in this. You can optionally opt in to the data sharing agreement that we have with the state of Michigan through a partnership with them and the local health departments in Canton, Ottawa County. We share this data if you so choose. And that, again, is one of our big initiatives behind the history of this tool, because Spectrum Health and the local Canton County Health Department reached out to us and said, we released a tool. It doesn't do everything that it needs to. Can you take it and build upon it from here and get us the data back? So that way, if an outbreak happens, if we need to do more contact tracing, whatever we need to do, we know how to get that data quickly and efficiently. And it's not something that somebody has to track a piece of paper anymore. So that data sharing just happens as long as you agree to it and gets to the right people that need to know. So it's also about, helping the state out where we can, because our goal with this project is not to, see this as a giant enterprise app, but it is actually more of a community tool. And that is why we tried to make it very affordable. It's basically $1 per user per month or per employee. So if you're a 30-person company, it's $30 a month. But one thing we're doing as a part of this webinar in partnership with Lakeshore is anyone who mentions that they saw the tool through this webinar, we're happy to give a 50% discount. So if you want to check it out, you can do that very easily by going to our website at simreport.com, clicking the Try SimReport button, which will take you to a form to get started. And again, mention that you saw us on this webinar, and we're open to a 50% discount on that. And that is everything I have.
Okay, wow, Brian, that's so generous. Thank you very much for offering that to those who are listening, and hopefully this will be reshared. So you never know what might flow in. So thank you very much for walking through all of that information. And I'm just impressed with how easy and user-friendly this site is, and that it's really more of a public health tool than a enterprise app, like you mentioned. So
Thank you.
let's jump into some of the questions that we received. So we'll just work through these until we run out of time, and then if there's some dialogue that we want to have too, so there's more like a conversation, we can certainly do that as well if we have time. So Sean, this first one is for you, one that came from our attendees, and you touched on this, but the question is really, do employers need to keep a record of daily self-health assessment checklists completed by employees? So the tracking is happening. Where does it go, and what should they store? What kinds of things are MyOSHA going to want to look at? Should there be an investigation or a complaint, or how would you answer that question?
Sure, absolutely. And I would just like to say that before we get off, there's one thing I want to announce that I forgot about. But from a MyOSHA perspective, the goal is always to mitigate the risk. And the first step of that is always to remove the risk from the workplace. So that health screening is critical to making sure that COVID's not in the workplace the best that we can, and all those other mitigation tools work to the maximum extent practical. But yes, if we were to get a complaint saying that you're not doing the health screening or something like that, MyOSHA is absolutely going to ask you for your health screening records. Now, that doesn't necessarily mean that we need to see the results of those screenings every day. We just need to know that you're conducting it. So we would expect to see what questions you're asking, and a list of those questions being answered. And if you're using an app, you may have that record already. If you're doing it in person at the door, it's just a checklist. Sean, Angela, et cetera, answer the questions affirmatively. And if it's a piece of paper they're handing you, I would just keep it for a couple of weeks. The actual incubation period of COVID is about 14 days or so, right? So every 14 days, if nothing's happening, then those previous records really don't mean anything from a health perspective. But we're just going to be looking that you're conducting it thoroughly, and people are actually answering the questions.
Okay. The next question here is a little bit along that same vein, but I think, Brian, you may have some insight on this too, but what protocols should a business implement or take if they begin to have multiple confirmed cases? So one, I think, is really, what does MyOSHA want to see happen in this event? And then to Brian, just to talk about, like, if you have an app, how you can detect that sooner and pinpoint it.
Yeah, that's a fantastic question. And in fact, I'll let maybe Sean handle the MyOSHA stance on it, because I don't want to speak for them since he's present, and that's very convenient for me. I would say from an app perspective, the thing that most of them will do, including ours, is if someone is, answering the questions in a certain way in one point of the day, and then they come back later and they answer it again, we're keeping a history of every single time they take the check at the front door, if you will. So having that data that you can go back to and provide to make sure, to someone who's asking for it, like MyOSHA or other health department officials, here's what happened, and being able to connect it to your employees. Because what the health department has told us is that the first thing they're going to do is they're going to try to call and get a hold of you, and then try to figure out who you've been in contact with, and then try to call and get a hold of them to make sure you know to go self-quarantine. So it's crucial to be able to tie the employee data to your system so that you know that full picture of where that person has been. Again, it's all about trying to get to the outbreak faster. And we've heard from the health department that other apps who didn't maybe store the phone number or the email or the contact information the right way or the full address, they then try to call and get a hold of these people when a test comes back, and they're not getting an answer because it's the wrong phone number, or they're walking into a building that has 10 businesses and they're not sure where to go. So having the accurate data and the history for that is crucial if we're going to get over this whole thing as quickly as we can.
Yeah, and I would just add, I can't stress this enough to you all. An outbreak does not mean an error. So do not be afraid to call my OSHA if these things are starting to happen. I think, one thing to keep in mind is that this is a public health crisis that impacts workplace safety, right? So public health on the outbreaks are going to be the ones that are looking more closely at how you're reporting. Keep in mind you have an obligation, if you have a confirmed case, to report to the public health department. And the goal of that is not to come and try to get you all in trouble. It's to identify the outbreaks, figure out what's happening, do the contact tracing. From a MyOSHA perspective or a workplace safety perspective, we'd be looking at you to get those people out of the workplace, potentially close that area for a deep cleaning, do the deep cleaning, reevaluate, keep reevaluating. If this is happening in the workplace, what am I doing? Did I not space the lockers enough? Do I need another protective barrier? Are my folks not wearing the face coverings? We know it's hot and miserable at times to be wearing that face covering, but if they can't maintain that social distance, we have to have that happening, or a whole bunch of physical barriers to make sure that they're not spreading the virus.
Thank you, Sean, for that clarification. I think what you said about, an outbreak does not equate an error is just so important to stress right now, because I know there's a lot of fear from employers about not only do I have all the protocols in place? What happens if I can't contain it? What's going to happen to us if we do end up with a case? So thank you for providing that clarification. You, Sean, have talked about masks a couple times today. One of the questions we've seen a few times is if a company is generally not open to the public, other than maybe for a delivery or occasional drop-in, are they required to comply with the face mask order?
So you'd be required to comply with the face mask requirements in the workplace safety requirements. And, just a note, a delivery driver or something like that just coming in, what we're really looking at is, can you control the people coming in your door? So a delivery person, you can have no contact deliveries, whatever, leave it on the dock. But that delivery driver is supposed to be doing a health screening also, should be wearing a face covering and doing all of those things, right? So we can control that flow of people, and visitors and stuff coming into your location need to do the health screening coming in and follow the workplace safety requirements. What we're really focused on with 153, the general masking requirement, is those areas where anybody can just walk in. So that's kind of the differentiation between the two.
Okay, great. Thank you for that clarification. Sean, you had mentioned before, we're getting close to being on time here. You have an announcement before we hop off. Did I?
Yeah, so we've
that?
been working on within MyOSHA for a while now, a potential grant program related to COVID specifically. I think the press announcement is going out today. The grant period will open on Monday and close on August 7th. All of the information should be going up online at some point today as well. I wanted to say this because I think the press release just went out. And we got about $8.55 million. We're going to be focused in on employers with 250 employees or less. It's an up to $10,000 matching grant for purchasing PPE, physical barrier, sanitizer, cleaning stuff, all of the things that you need in your workplace. We're going to try to sort of buck that around certain types of industries and give some preference to those that are, higher sort of community transmission, which would be like high density manufacturing. Certainly those places open to the public. But, just check out that COVID workplace safety. We'll get a link right up there, and be prepared to apply for that grant if you think you can use it to enhance the safety of your workplace as it relates specifically to COVID.
Excellent. Thank you for sharing that, giving us maybe not quite insider information, but almost. It's always
Almost.
exciting to have those at our fingertips. So we'll be sure to share that out through our channels as well. So that is actually all the time we have for today. So if you do have follow-up questions for our panelists, there's contact information there. There's the MyOSHA hotline. You can reach out directly at SimReport.com if you're interested in that. And just as a reminder, the webinar will be sent to anyone that was registered and will be posted on the Lakeshore Advantage COVID-19 page and our YouTube channel. So if you want to listen again, you missed something, or you want to share it with others, you can find it there. So a big thank you to Sean and Brian today for taking time to join us, share all the knowledge, demo these sites, guide us in these best practices, and just bring this information to us that's timely and important for everyone. So thank you to our panelists. Thanks to everyone who could join us today, and have a great afternoon.